So just a brief disclaimer before we get started. The contents of this proposal are hypothetical because it is purely an educational requirement. So this project should not be taken literally because it has not undergone any kind of testing or trials. So this is only intended to fulfill the requirements for our course NCM 110, Nursing Informatics. So we appreciate your understanding, so please allow us to commence the video. Good day to everyone. For this presentation, we'll be discussing our proposed system entitled weCARE, Patient Admission in a Public Healthcare Organization, a study on patients' access for care and services in the delivery room by the group Bondi. So let us now meet the team behind the proposed system. So I am Krista Gamolo, and along with me are Alisa Corangking, Saina Melendez, and Jay Javier. So presented on our screen is the overview of our whole presentation. First is our executive summary, followed by our planning phase, analysis phase, and system design phase, along with the designated contents. The executive summary introduces a proposed system designated to improve patient admission in delivery rooms. It takes into account factors such as bed capacity, patient needs, and the involvement of remote watchers. The main goals of the system are to enhance the patient experience, allocate resources efficiently, and promptly respond to the patient's requirements. And with our following goals in providing utmost care for patients in this healthcare institution, we will present this paper that comprises our planning phase, analysis phase, and the system design phase. We have included here our details that best explains our proposed system. We will begin with our planning phase, which comprises the introduction, statement of the problem, proposed system, the objectives of the proposed system, significance of the proposed system, and the scope and limitations of our proposed system. Let us start with the first part of our planning phase, which is the introduction that will provide the audience with an introducing idea of our presentation. So this proposal focuses on improving patient access, communication with watchers, and resource availability in healthcare facilities, particularly in the context of delivery rooms. The system aims to enhance bed capacity management by proactively distributing resources, responding to patient demands efficiently, and improving the overall patient experience. It emphasizes establishing dependable communication channels between healthcare practitioners, mothers, and watchers to assist the watchers, reduce their anxiety, and increase their involvement in the care process. The system also aims to automate the management of essential resources in the delivery room, such as medical supplies and equipment, to reduce delays and ensure quick access for caregivers. By implementing this patient-centered approach, healthcare organizations can create a pleasant atmosphere, improve the delivery experience, increase patient satisfaction, and achieve better outcomes for both the mothers and the newborns. Next is our statement of the problem, which will help the audience identify our main focus. The current patient admission system in many healthcare facilities is not entirely effective in providing a comprehensive and supportive delivery experience. This is due to a number of factors, including ineffective bed capacity management. So the demand for delivery beds can fluctuate dramatically depending on factors such as the time of the day of the week, and season. This can lead to long wait times for patients, which can be stressful and anxiety-provoking. Additionally, when beds are not available, patients may be forced to deliver in less than ideal settings such as hallways or waiting rooms. This can pose a risk to the safety and well-being of the mother and the newborn. So next is lack of effective communication with watchers. So watchers play a vital role in providing emotional support to pregnant women during labor and delivery. They can offer comfort, encouragement, and a sense of security. Additionally, watchers can provide important information to healthcare providers such as the patient's medical history and preferences for care. However, effective communication between watchers and healthcare providers is not always easy. This is often due to the fact that watchers may be feeling anxious or overwhelmed, or they may not be familiar with the healthcare setting. Additionally, healthcare providers may be busy and have limited time to spend with the watchers. Next is insufficient availability of resources. So having all relevant resources easily available in the delivery room near patients and their observers, it can help to reduce delays and ensure that caregivers have quick access to what they need. This is especially important in high-risk deliveries where time is of the essence. However, in many healthcare facilities, essential resources are not always readily available. This can lead to delays in care and decreased quality of care. So the proposed patient admission system addresses these key issues by, first, using a predictive model to forecast demand for delivery beds. This allows healthcare facilities to proactively manage bed capacity and ensure that there are always enough beds available to meet the patient needs. This can lead to shorter wait times for patients, reduced stress and anxiety, and improved safety and outcomes for mothers and newborns. Next is providing watchers with a dedicated communication channel with healthcare providers. This allows watchers to ask questions, get updates on the patient's progress, and provide important information to healthcare providers. This can help to ensure that watchers feel involved in the care process and that the patient receives the best possible care. Next is automating the management of essential resources. This helps to reduce delays and ensure that caregivers have quick access to what they need. This can improve care delivery and contribute to a supportive environment that addresses patients and their caregivers' holistic needs throughout the childbearing journey. The proposed admission system has the potential to improve delivery experience for both mothers and their caregivers by providing them with a more seamless, efficient, and supportive experience. So let us now proceed with our proposed system to present the details. The proposed admission system is a comprehensive and innovative approach to improving the delivery experience for both mothers and their caregivers. The system addresses the key issues of an effective bed capacity. The proposed patient admission system is a comprehensive and innovative approach to improving delivery experience for both mothers and their management. So lack of effective communication with watchers and insufficient availability of resources by first, using a predictive model to forecast demand for delivery beds, which allows healthcare facilities to proactively manage bed capacity and ensure that there are always enough beds available to meet patient needs. Next is providing watchers with a dedicated communication channel with healthcare providers, which allows them to ask questions, get updates on the patient's progress, and provide important information to healthcare providers. Next is automating the management of essential resources such as medical supplies, equipment, and comfort items, which helps to reduce delays and ensure that caregivers have quick access to what they need. So the proposed system is designed to be user-friendly and efficient, and it can be implemented in any healthcare facility. The system has the potential to improve the delivery experience for both mothers and their caregivers by providing them with a more seamless, efficient, and supportive experience. So, for the bed capacity management, the proposed system uses a predictive model to forecast demand for delivery beds. This allows healthcare facilities to proactively manage bed capacity and ensure that there are always enough beds available to meet patient needs. The model is based on a number of factors, including the time of day of the week, season, and historical data. So next is communication with the watchers. The proposed system provides watchers with a dedicated communication channel with healthcare providers. This channel allows watchers to ask questions, get updates on the patient's progress, and provide important information to healthcare providers. The channel is available 24/7 and can be accessed through a variety of devices, including smartphones, tablets, and computers. Next is resource management. The proposed system automates the management of essential resources, such as medical supplies, equipment, and comfort items. This helps to reduce delays and ensure that caregivers have quick access to what they need. The system is integrated with the healthcare facilities inventory system, so caregivers can easily request and track the status of resources. The proposed patient admission system is a comprehensive and innovative approach to improving the delivery experience for both mothers and their caregivers. So this is designed to be user-friendly and efficient, and it can be implemented in any healthcare facility. The system has the potential to improve the patient delivery experience for both mothers and their caregivers by providing them with a more seamless, efficient, and supportive experience.
I am Alisa Kuranging, and I will now present the objective of our proposed system to let the audience know our purpose in motion. First, develop an electronic and well-developed system that monitors and manages the bed capacity in the hospital. Second, train all healthcare providers in the delivery room on the proper usage of the newly developed patient admission system. Third, implement a reminder system that prompts the nurses whenever a room is available for use. Fourth, use a systematic way of registering patients in the facility that collects the necessary data of the patient, such as demographic data and insurance information. Fifth, establish an initial triage and assessment for the urgency of care that prompts the healthcare professionals involved, such as nurses, midwives, and physicians. Sixth, provide a dedicated communication system for watchers and nurses to communicate well, ask important matters such as questions, and stay updated on the status of the laboring mother and the progress of delivery. Seventh, create an effective communication system for postpartum care that would help monitor the health status of the mother and infant to assess the readiness for discharge. Eighth, regularly evaluate the effectiveness of the electronic monitoring system and nursing informatics interventions to ensure they are achieving the desired outcomes for enhanced admission and discharge monitoring system. So, what is the significance of our proposed system, you might ask? The proposed system paper aims to improve the patient admission system in the delivery room of healthcare facilities. It focused on bed capacity management, effective communication with observers, and ensuring the availability of necessary resources. The system aims to enhance patient access, streamline workflows, and improve the overall delivery experience. However, it is important to consider the system's limitations, such as its applicability to other healthcare settings, technical considerations, human factors, and legal and ethical considerations. Healthcare institutions should carefully evaluate these factors when implementing and customizing the system in their delivery room. Lastly, the whole proposed system is solely limited in the delivery room. For the last part of our planning phase, I will present the scopes and limitations of our proposed system. The proposed system for studying patient admission in a public healthcare organization with a focus on access to care and services in the delivery room has important implications. The study can identify barriers and challenges affecting patient access, uncover risk and safety concerns, assess resource utilization, improve the patient experience, inform policies, and guide quality improvement initiatives. By understanding and addressing these issues, healthcare organizations can enhance patient safety, optimize resource allocation, improve patient satisfaction, and drive positive outcomes. Let us now proceed to our next phase, which is the analysis phase, which comprises the data collection, data analysis, and users' requirements. Presented on the screen is our swim lane diagram that presents the workflow. The patient enters the healthcare facility, registration staff collects patient's data, patient is admitted, patient is assessed, nurse provides care plan, staff allocate bed for the patient is admitted to the delivery room, staff prepares all necessities of the patient, communication channels are provided for the watchers, nurse updates watchers on patient status and needs, mother is ready for delivery, baby is delivered, patient is transferred for postpartum care, all patient necessities are transferred along. Ongoing monitoring of baby and mother is provided, nurse ready discharge plan, patient is ready for discharge, and the patient exits the healthcare facility. This table is our functional requirements, which has the login page that welcomes the user homepage that presents the overview of the site, the select option that contains options, the real-time data collection and analysis that is used for patient data and to determine their necessities, initial assessment and bed capacity to determine whether a patient is in need for urgent attention, the data validation and verification for confirmation, and informant and watcher contact details for better communication, print confirmation for the hard copy of details, watcher communication and support to ease anxieties and report patient needs, and the logout page to exit page or site.
I am J. Cashier Javier, and I will now continue the discussion by presenting the user's data, which includes patient's data, nurse's data, and the medication directory data along with what should be included. Next, We have our present medications data, which includes information about vitamins, minerals, supplements, maintenance medications, and treatment medications. So what we have here then is our interventions data table, which presents the physician's notes and its details. What we have here is our table for the user's requirements, which includes the users of our system. These users are the nurse, midwife, watchers, registration staff, IT specialist, and the hospital administration. Additionally, in this table, it will include the aforementioned user's description and authorization.
I am Saina Melendez, and we will now begin with our third and last phase, which is the system design phase, starting with the system conceptual framework. A well-designed patient admission system is crucial in public healthcare organizations as it sets the tone for the patient experience. The system should focus on bed capacity management, effective communication with watchers, and the availability of required resources. By effectively managing bed capacity, using predictive models, and implementing technologies, healthcare facilities can ensure timely access to care. Establishing reliable communication channels with watchers and offering support services can enhance patient experience. Automating the management of resources improves care delivery and addresses holistic patient needs. Staff training, technology utilization, patient education, resource optimization, and improving patient experiences are additional factors to consider for a successful patient admission system. By prioritizing these components, healthcare organizations can create a patient-centered care approach that enhances the delivery experience, patient satisfaction, and overall outcomes for both mothers and newborns. Now for its conceptual framework for system users interface. This shows the whole framework of the system while providing the visual aspects for a better understanding of the concept. The patient enters the healthcare facility, registration staff collects patient's data, patient is admitted, patient is assessed, nurse provides care plan, staff allocate bed for the patient, and then patient is admitted to the delivery room. Staff prepares all necessities of the patient. Communication channels are provided for the watchers. Nurse updates watchers on patient status and needs. Mother is ready for delivery. Baby is delivered. And patient is transferred for postpartum care. All patient necessities are transferred along. Ongoing monitoring of baby and mother is provided. Nurse readies discharge plan. Patient is ready for discharge. And the patient exits the healthcare facility. Let us proceed to our system users interface. So this paper emphasizes the importance of a user-friendly interface in healthcare applications for efficient management of patient information and administrative tasks. It discusses the design and development of comprehensive user interface including essential pages such as login, home, patient directory, patient's data, admission data, patient watcher or informant's details, print confirmation, and logout confirmation. So the login page serves as the entry point, while the home page provides an overview of notifications and system updates. The patient directory page enables searching and viewing patient lists, while the patient's data page displays detailed patient records. So the admission data page manages admission-related information, and the patient watcher or informant's details page facilitates communication with authorized individuals. The interface also allows for printing important documents and ensures secure logout. By focusing on a well-designed interface, healthcare providers can efficiently manage patient information, improve communication, and streamline administrative tasks. We have here the design of our system's user face, which includes the weCARE login page, weCARE homepage, weCARE patient directory page, weCARE patient's data page,
weCARE admission data page, weCARE informant's details page, print confirmation, and our weCARE logout page. Here we have our social media content, which is a great way for promotion of our system and to spread our objectives in providing better care of our patients. We have provided a link that leads to our Facebook page and its image overview. That's all for our presentation. We hope that we were able to relay our message in being able to deliver a proposed system that would help improve the healthcare institution's patient care, especially in the delivery room. Thank you and have a great day ahead.